Howdy. These offices always have to be
Are you chilly?
chilly, yes.
I apologize. It's nice to meet you, Maurice. My name is Dr. Perez.
Howdy.
I will be your chiropractic specialist today. It's very nice to meet you. I have your chart here and I was going over a couple of things based on what we have on you in our computer system. So let's get started with just a few preliminary questions.
Okay, remember I'm about 30% deaf, so
Okay. Can you hear me okay?
yeah.
Okay. So I will try to keep that in mind as we move forward with our assessment. So
Sound like my wife. That frequency just goes in and out.
can I have you confirm your age for me, please?
69.
69. Thank you very much. And I have that you are here pending an evaluation for your right upper extremity, so your shoulder.
Shoulder.
Okay.
I dislocated it 40 years ago and now it's haunting me.
40 years ago. Okay. Okay, so I will ask you a couple follow-up questions about that in just a moment. Before we get started, I'm just going to ask you a couple of kind of regular questions about your day-to-day activity. So,
Okay.
do you follow any special diet? Do you eat a regular diet most of the time?
Yeah.
Any sort of special
A lot
restrictions?
of meat and vegetables.
Okay. So high protein, high fiber. Any carb restrictions or anything? You're not diabetic, correct?
I just try not to.
Okay. And I have your code status as a full code, so we will keep that in mind pending emergencies. As far as your at-home oxygen supplementation, I have that you wear a CPAP at home. Is that still accurate?
Oh wow, is that considered that? That's
Yes.
weird. Yeah, I do use the CPAP.
Okay. Okay. And you're not currently seeing a physical therapist for the pain or injury, but you do see a chiropractor as far as I'm aware?
I do see a chiropractor.
Okay. Okay, so we can go ahead and get started with the preliminary assessment. Essentially what that's going to comprise of is just me asking you a couple of questions to get a baseline idea of what's going on, what we may need to treat. I will then get a set of your vital signs, and then we'll move on to a physical assessment where I'll kind of have a look and see what's going on, and then we'll move forward with treatment from there, okay? Okay, so we will allow our therapy cat to just kind of move around as she pleases. This is baby cat. All right, sir, so can you tell me what your current pain level is, if any, on a scale of 1 to 10?
8.
Currently at an 8. Okay, so pretty high. Would you say that's about where it usually stands, or does it kind of fluctuate?
Yeah, lately 7 or 8.
7
if I stress it.
Okay.
I try to remember to do those windmill movements with it, and that helps sometimes. But
Okay. Okay. When would you say it's the most painful? Is it like when you wake up in the morning or at the end of a long day?
at the end of the day,
At the end of the day, it's the most painful. So when you wake up in the morning, can you give me like a base rate, what you think it is without any exertion? So after just sleeping all night and you've not really been moving it very much.
yeah, it hurts.
Still hurts?
Yeah.
Okay. Okay, so it's just kind of baseline pain. It's not only with exertion, so that is something to keep in mind. And as far as your history of injury, you said you had a dislocated shoulder about 40 years ago.
Right.
Can you tell me about how that occurred? Do you remember?
Yeah, I was on a little dirt bike thing and went over elbows and landed on it.
Okay. Did that require any surgery, surgical intervention?
No, they just strapped it to my body for a couple days.
I know you've been having this pain for a little while now. Have you had any imaging done as far as x-ray, MRI to look at the bone structure
Yes.
or anything you have? Okay. Do you remember the findings of that by chance?
Couldn't see nothing was wrong
Nothing
with it,
significant.
except that it had been.
Okay.
They could tell that it had been separated. I don't know how they do that. nothing.
Okay. Probably some scar tissue in there that was notable. Okay. All right. Would you say the pain is isolated to that one specific area, or do you feel like it radiates anywhere else?
Well, sometimes it's just in front, sometimes it's just in back, and then sometimes it's both, but it feels like it's like the same, you know, stress area.
No radiation up to your neck or kind of down further. Okay.
It's a pain in my
Okay. A little bit of radiation there, maybe.
Yes, thanks.
Okay. And if you could just point to me where exactly the pain is centralized.
Okay, it's either right here, right in front, underneath the blade right there, or whatever that is, and then the same thing in back.
Okay. So I will keep that in mind as we move on with our physical assessment. In your daily life, whether it's at work or at home, do you use any sort of repetitive movement where you're moving your shoulder in the same motion?
Well, I shoot pool for 3 or 4 hours a day, so.
Okay. So that could actually have something to do with it. This could be a stress
I
injury.
refuse to believe that.
Okay. So we'll keep that in mind. And then I did see that you are a Class A truck driver.
Yes.
Does that require any manual labor?
Yes, that's what's doing it. It's not the pool.
It's not the pool. It's the work. Okay, so we'll keep that in mind.
It's shifting gears and.
Okay.
Oh wait, my truck's an automatic now. I don't have to.
Okay. And I did see that you have a history of arthritis.
Yes.
Okay. About how long have you had arthritis? Do you know the onset of that?
About 5 years.
5 years. Okay, so relatively.
Maybe 10. I don't know.
5 to 10 years. Okay. Got it. How frequently do you see your chiropractor?
Only because I've only had him about 6 months. I've seen him probably 6 times in the last 6 months.
Okay, so about once a month. And when you see him, is he typically treating this injury or just?
No, he was getting me. I was walking like a crooked letter, so.
Okay, so
he was
just
fixing
an
my whole
overall
back.
adjustment. Okay. Now, are you experiencing any numbness in the area?
No.
So as far as you're aware now.
My fingers and everything's fine.
Okay.
Knock on wood.
Any tingling or pins and needle feeling?
Tingling, no.
No. Okay. All right. I think we have enough information to go ahead and get started. So I am going to move on to just getting a quick set of your vital signs just to make sure that everything looks okay before we proceed. Is that all right?
Just remember I have blue coat, blood pressure, so. Anytime I see a doctor or something.
White coat syndrome, is that what you're referring to?
Okay.
Okay. Just gonna clean my hands. Do you typically have any issues with elevated blood pressure?
Yes.
Are you hypotensive? Okay. Hypertensive, excuse me. All right, so I'm just going to get a pair of gloves on and I will go ahead and obtain your vital signs.
Why are rubber gloves always intimidating? It's just like, it's not right.
Are you overdue for your prostate exam? I know a guy.
No, I ain't doing that again. I just had that with the VA 6 months ago.
Okay, well, you're up to date then. Nothing to worry about.
Alright. I've seen that movie.
Okay, so I'm just going to be taking your blood pressure manually today. I'm gonna go ahead and take it in your left arm because you're having pain on that right side, so. Okay, I'm gonna have you pronate your hand for me and just rest down. Okay, it's gonna be a little tight. Okay, 138/72.
Thought I was gonna nod off there for a minute.
So your systolic was slightly elevated, but I would still consider that within normal limits for your
I know there's
age.
English in there somewhere. Systolic, something to do with the moon, right?
So your systolic blood pressure is the number that we say first. So the 100 number over the diastolic, which is the number that goes on the bottom.
Wow.
Nothing that really matters to you.
Thank you
That's
so
okay.
much. One less thing I gotta worry about.
So I am just
So
gonna
the
go ahead
upper
and
was
check.
higher or bad, or the lower was bad?
Very slightly elevated.
The upper one, okay. Darn, and I thought that was a good grade. You should have seen it last week.
Do you take blood pressure medication regularly?
Yes.
Okay. And then I'm just gonna check. Okay, good. So I'm not seeing any hot spots anywhere. All of that is okay.
She shoot you with that thing? I don't know.
So your temperature was 98.2. Respirations are about 17. And your blood pressure was 138/72. Okay. All right, so let's go ahead and move on with our visual inspection. So what I'm gonna do at this time is kind of have a look at you and see if there's anything I'm noting on an external level, see if I see any signs of further dislocation or if anything looks asymmetrical, things like that, okay? So let me just get adjusted here and we will go ahead and get started. All right, Maurice, so is it all right if I just undo your gown here so that I can have a look?
Okay.
Okay. So I'm just gonna untie this and, okay. Go ahead and sit up straight for me. Just gonna pull this down here so I can have a look. So just sit still for me for a second. I'm just overlooking your bone structure, having a look at your chest wall as well as your shoulders.
Let's see, this used to be my chest.
Things change as the years go by. So it does look like your right side is sitting slightly lower, so you're kind of like this.
We are going north to south, right? So,
I'm gonna have a look on this side and see. I'm gonna have you turn your head for me all the way to the left. Any pain or discomfort anywhere on that right side?
Just in the muscles.
Just a little bit.
A little
Okay.
tight.
And right where that pain was? No. Okay. And if you can turn all the way to the right, same thing. Any pain or discomfort there?
No.
Okay. Okay. So I'm going to start with some manual palpation. So I'm just going to be using my hands to kind of feel around in the area comparatively to the other side, and then I'll have you turn around. So for now, you can just relax for me. Just let me know if any of this is uncomfortable. Any discomfort on this side? And how about here? Okay. Any pain or discomfort here? How about in the clavicle? Nothing here.
No.
And if I palpate deeper, does this hurt at all?
No.
A little bit there?
Mm-hmm.
No, so just right here. Okay. And that same location does not hurt on this side, correct? Okay.
Can I go ahead and rotate it?
Sure. Does that
It's a
alleviate some
miracle.
of that
I'm
pain?
cured. I'm cured. Think that when you go to the doctor, it hardly hurts there for. Oh no, never mind. There we go. So yeah, it's right in there.
Okay.
It's just got to aggravate it a little bit. I'm not touching you. I'm not touching you.
Does it alleviate the pain when you rotate it like that?
No, sometimes it makes it worse, but supposedly over time, it's supposed to loosen that joint back up or something, or stretch something, or you're supposed to do something to make it feel better. Personally, I think they're full of shit. It just makes it hurt. They're full of it. How's that?
I am going to have you go ahead and turn around on the table for me. So you're just going to face the opposite direction so that I
Okay.
can have a look at your back. So I can move this out of the way for you so that you can just spin around, whatever's easier for you.
Yeah, sure I will.
All right, Maurice, thank you very much for turning around for me. I am going to go ahead and proceed with a visual inspection of your back as well as the back of your neck and of course the affected area here. So I'm just going to start by having a look at your neck and spine. So at this point, I'm looking to make sure that everything is midline. Again, that I'm not seeing any signs of asymmetry or any obvious deformities that could be related to the pain. So having a look here at your posture, which doesn't look too bad. Again, I am seeing a misalignment here. So your shoulders are not quite even. Spine does look midline though, not seeing any obvious signs of scoliosis or muscle wasting here. Okay, so I'm just going to notate that finding that I'm seeing here. So it does appear as if your right side is slightly offset. So, again, no signs of any muscle wasting. Your deltoid and trapezius muscles both appear to be well intact there, so that is great news. Okay, so what I'm going to do at this time is have you turn your head all the way to the left for me. So turn your head all the way to the left.
I'm having trouble hearing you.
Go ahead and turn all the way to the right. Okay. Now, if I palpate here, can you tell me where your pain is back here, if any?
None.
None of this hurts?
No.
Okay. Can you take a deep breath in for me? Go ahead and release. One more time. Go ahead and release.
That's a little sore there.
Here?
No, inside the bottom
Here.
finger, now go towards the, where your thumb hit. Yes, over there, that's like a knot there or something.
Okay, so soreness here.
Yeah.
Ooh, okay, sorry. Sorry.
That thing.
Does it hurt anywhere else in this area?
Well, you haven't got to it yet. Yeah, there's something else right there, yeah.
Okay. So this is the back of your scapula.
Okay.
Sorry.
I believe you.
I'm just trying to isolate the pain. I apologize. Okay, so the whole side there is sore. Do you have any of that same pain over here?
Not yet. Ouch. No, that side hasn't bothered me.
Okay, just making sure.
Jesus.
So I'm gonna go ahead and just check for any temperature abnormalities here. I'm checking for any hot spots that might indicate some inflammation there, since it is hurting. Okay. Sit tight for me. I'm gonna take a couple of measurements here, okay?
Don't poke me there again.
Okay. So just using this tool to measure for symmetry on both sides. I'm just basically looking for any signs of inflammation here, for any swelling. Okay. So we are slightly off center there. You're gonna feel a slight pinching. It shouldn't cause you any pain here, okay? Again, I'm just looking for any signs of excess inflammation. Okay, so I am seeing a little bit of retention here. So I have a reflex hammer here. I'm going to be doing some very gentle percussions of your back.
Okay.
I want you to let me know at any point if it becomes painful to you, okay?
Okay.
Any pain or discomfort here?
No.
And all of that feels okay?
No problem.
Okay. Anything along the spine here? That feels okay?
Yes.
Okay. Okay. Okay, so at this point, I'm going to perform a test of your neurological functions. I want to make sure that there's no nerve damage that's happened internally, okay? So what I'm going to be doing is just applying different stimuli to the skin, and I'd like you to just indicate what you feel. And I will let you know what it will be before I do it. That way you can give me a positive indication, okay?
Okay.
So, to give you an example, this here is cold. Can you feel that?
Right there I can, yeah.
Okay. So when I touch it to your skin, I'd like you to just say yes.
Okay. Yes. 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 Yes.
Perfect. Okay. So the next thing I'm going to do is alternate between two different sensations. Now this one here is going to be very sharp. Can you feel that this is sharp?
Sorta.
Okay. In comparison to this, can you feel this?
Yeah.
Okay. So this is dull.
Mm-hmm.
I'd like you to just say dull or sharp, okay?
Okay. Dull. Dull. Sharp. 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 Spider. Dull.
Good.
Sharp. Dull. Sharp. Sharp. Dull. Sharp.
Good. Okay. Now this one is a very difficult indication, okay? Can you tell me whether or not you feel anything?
Yes.
Okay. So again, just say yes if and when you feel it.
Yes. 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 Yes.
Good. Okay. Now the last test is going to be testing for any differences between either side. So I have an identical device here that I'll be running along both sides, and I'd like you to just indicate whether or not it feels different from the left side, okay? So does that feel the same?
Yes.
The same.
Yes. 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 Yes.
Good. So no differences whatsoever.
I've got an itch over here though. Could you set it up one more time? Thank you. Okay.
Okay. Now we're going to go ahead and move on. I have an acupressure device here that I'm just going to be using to localize your pain. So I'd like you to just indicate to me where it starts to hurt in this area, okay?
Okay.
So we're gonna start here.
No.
There.
There's a little something there, yeah.
Okay.
Yeah.
Here. Anything here? A little bit here.
Yeah.
Nothing here.
Mhm.
Okay. And nothing, a little bit there?
A little bit.
Okay. So we have a decently localized area here that I will be having the chiropractor have a look at there. So we've kind of localized an affected area, at least on the back perimeter there, okay? All right. So the last thing we're going to do for your examination is perform a couple tests of your mobility, and because you are having pain, it is likely going to be uncomfortable. The purpose of this is just to see what your limitations are on that affected side, okay? So what I'd like you to do is shrug your shoulders for me simultaneously there you go. Any pain there?
A little bit.
Little bit?
Through the blade, yeah.
Okay. Can you bring your shoulders back together? Any pain there?
No.
That's fine. Okay. Good. Can you arch your back for me? Any pain there?
No.
Good.
All of it, every string is like a little.
You feel it a little bit.
Pain to that side, yeah.
Only on this side.
Right, only on this side.
Okay. Now, if I guide your elbow back here, tell me when it's painful, if at all. That's okay.
Yeah.
Okay, that's good. Now, are you able to extend without pain? Does that hurt at all?
Up until about right there.
Right there.
I can feel it.
Okay. Okay. Can you do that with this side? No pain at all there.
Yeah, just snap, crackle, pop.
Okay, so just
Yeah.
regular, probably age related to your arthritis. Okay. Okay, now the pain that's in the front, about here?
Yes, up in there. Yeah.
Okay, sorry. Okay, all right, Maurice, so I have a pretty good indication of what I think might be going on. It looks like you have a strain, possibly a soft tissue ligament sprain in your scapula that's kind of radiated through the muscle back here where you're feeling that tension. Now, because you already had imaging with your regular doctor, that was your VA doctor, correct? Yeah. Okay. So those images did come back negative for anything significant. So your shoulder is not out of place or anything like that. So at this point, what I'm going to do, if you have time this evening, I'd like to have our chiropractor come in and do an assessment as well as possible adjustments for you, okay?
Sure. Does he like to pop things?
He does.
That's the best stuff.
Unfortunately, we only have a young lady in the office this evening. Her name is Sarah, so I will be sending her in for you.
Okay.
But she's very good at her job, okay? Okay, so she should be in shortly. You are welcome to go ahead and lay on the table face down.
Okay. Cool.
Okay?
Yep.
Alrighty, we'll see you in just a bit.